Physiology of Menopause and Hypoestrogenic Changes by Kelly Cole and Brianna McCall. Menopause is a natural process by which a woman transitions to permanent cessation of menstruation. Women usually experience this physiological change between the ages of 40 and 58 years old. This occurs due to the number of depleting ovarian follicles, which impacts the hypothalamic pituitary ovarian axis, ultimately resulting in amenorrhea. Menopause is retrospectively diagnosed after 12 consecutive months without having a menstrual period. This milestone reflects the end of fertility and results from the ovary's diminished capacity to produce estrogen, progesterone, and other reproductive hormones. These changes in hormone levels typically cause an array of symptoms for about 80% of women. However, menopause is a very individualized experience. Some women face intense symptoms that affect many areas of their lives, while others go through it with little to no discomfort and hardly notice any changes. More women are reaching menopause today because the baby boomer generation, which is the largest group of middle-aged people historically recorded, is now in menopausal age. Menopause is an inevitable part of women's healthcare that midwives will most likely encounter at some point during their career. To provide proper support, midwives should understand the physiological changes that occur during this transition and how they impact a woman's body.
Hormonal changes. There's going to be fluctuations day to day as the ovaries produce less estradiol, progesterone, and androgens. And then during the perimenopausal transition, 2 to 8 years, less follicles mature. With the few follicles that do develop, they aren't as responsive to FSH. The negative feedback loop between the ovaries and hypothalamus is lost, so it doesn't get the message from high estrogen and progesterone to stop GnRH. So the anterior pituitary continues FSH and LH production. So what you're going to see is elevated FSH and LH. Estrone is the predominant estrogen of menopause. It's fat-derived and secreted by adrenals and a very small amount by the ovaries. Just to preface the list of hypoestrogenic effects, all women experience menopause differently. Some will have many of the listed symptoms and others will barely notice they're in menopause. There can be irregular menses, anovulation, amenorrhea, vasomotor symptoms, sleep disturbances and insomnia, concentration issues and forgetfulness, rapid bone loss in that first year, and then skin thinning related to collagen loss. GSM includes vaginal atrophy, dryness, vulvar irritation, dyspareunia, and a predisposition to UTIs, urinary urgency, and dysuria. There will be lower libido, leading to less sexual activity. The CVD risks are related to hypertension, valvular heart disease, and coronary heart disease. Dyslipidemia includes high total cholesterol, triglycerides, apolipoprotein B, and LDL. HDL is usually lower. Diagnostic markers are predominantly clinical. Menopause is a retrospective diagnosis in that it has long been understood there must be 12 consecutive months without menses to diagnose menopause. Menopause is a physiological transition related to changes in the HPO axis. Anovulation is related to less responsiveness of follicles to FSH. The ovaries produce less estradiol, progesterone, and androgens. And because hormone levels fluctuate, it is not recommended to measure them as they don't provide meaningful information for clinical management. And that includes AMH, which is normally used to determine ovarian reserve. And then FSH, if it's performed, will be greater than 30 IUs per liter, confirming ovarian failure.
Certain health conditions can mimic symptoms similar to menopause, making it important to exclude differential diagnoses. Some conditions include infection, anovulation, thyroid disorders, depression, and pregnancy. All women presenting with perimenopause and menopausal type symptoms should undergo a thorough history and physical, along with lab testing to rule out other causes. Due to hormone changes and the normal aging process, women during this stage of their life are at increased risk of developing certain health conditions such as cardiovascular disease, osteoporosis, and diabetes. Cardiovascular disease is not specifically linked to menopause. However, age does play a role in this diagnosis. Total cholesterol, triglycerides, and LDL cholesterol all tend to increase in postmenopausal women, along with the thickening of the left ventricle. Decreased elasticity also impacts the cardiovascular system, increasing the chance of developing hypertension. Prevention is aimed at reducing risk factors such as cigarette smoking, inactivity, obesity, and treating conditions such as hyperlipidemia, hypertension, and diabetes. Osteoporosis is more likely to occur in women as levels of estrogen decrease, causing a decline in bone mass. This is most significant during the first 12 months after menopause. Prevention strategies include supplementing with calcium, vitamin D, smoking cessation, limiting alcohol consumption, and increasing exercise. The risk of developing diabetes increases as women age. Lower estrogen levels, weight gain, and increased androgen activity all contribute to higher glucose levels observed during and after the menopausal transition. It's important to understand that many postmenopausal women will likely need pharmacological management of their type 2 diabetes. Promoting healthy lifestyle modifications through nutrition, physical activity, and weight loss can help delay or reduce the risk of diabetes. Menopause is a natural milestone experienced by all women, yet it remains a unique journey for each person. It's marked by the cessation of menstruation and the end of reproductive ability due to the ovarian follicle depletion and hormonal shifts. Occurring during midlife, this process involves declining estradiol, elevated FSH and LH, and a shift in estrone as the dominant estrogen. Women experiencing menopause can have symptoms ranging from vasomotor disturbances and sleep disruptions to long-term risks like cardiovascular disease, osteoporosis, and diabetes. Many women experience symptoms, but it's important to know that this journey is very individualized for each woman. Some face life-altering physical and emotional challenges, while others transition with minimal disruption. Regarding the long-term risks, it's important to be proactive in preventing these occurrences from happening by ensuring women have access to the resources and information they need. Midwives are prepared to provide compassionate, evidence-based, individualized care to the aging woman. By understanding the physiological complexities such as hormone fluctuations, diagnostic markers, differential diagnoses, and age-related health risks, midwives can empower women to take control of their health. Midwives can ensure that women navigating this transition do so with grace and informed choice.